In 2018, my life changed forever. First, the fever, next, the pain, and then the swelling. The worst of it all was the cries from the intense pain caused by blocked blood vessels. This isn't just my story, but the story of my two sickle cell warriors, Emery and Evan. They were just 2 and 3 years old at the time when they found themselves in the middle of a full-blown sickle cell attack. Sickle cell disease is an inherited blood disorder that causes the cells to become abnormally shaped, causing a disruption of blood flow, which leads to a variety of complications, according to the CDC. Which made me question, how did my beautiful, innocent toddlers end up with such a terrible disease? I learned that if both parents have sickle cell trait, there's a 1 in 4 chance of having a child with sickle cell disease in each pregnancy. So what were the odds of me having 2 out of 3 of my biological children inherited sickle cell? So this situation taught me 2 things. First, if my odds were that great, I should have played the lottery. Second, I wasn't just a mother anymore. I was a mother of warriors, which meant the war started with me. I became a fighter, an advocate, a student of a disease that I knew too little about, and a navigator of a system that wasn't designed to help us thrive. Now I'm a proud Detroiter, now residing in Northwest Ohio. So my first instinct was to seek out resources, to find a community, to gather every tool that I could. But what I found was nothing. No roadmap, no welcome packet, no village to walk with me. That sent me back to Detroit, where I had to teach myself everything. Not just about sickle cell, but about the field of advocacy itself. I wanted to know how policies work, how systems were shaped. And those answers or questions from those answers sent me back to school, where I chose the field of social work. Because if the system wasn't going to guide us, I was going to help build a new one. Sickle cell disease isn't just a diagnosis, it's a daily fight for survival. It causes the red blood cells to be shaped like crescent moons, causing blockage, organ damage, strokes, and even early death. In the United States, approximately 100,000 people live with sickle cell disease. Now, the majority are Black, but the reality is it also impacts Hispanics, Middle Eastern, Asian, and Mediterranean descent. The first 2 years of Emery's life, I was unable to keep a job. His hospital stays were so constant, so frequent, I lost count. But through all the fear and frustration, I made a promise that no family would ever feel that same void. The void of helplessness, not knowing what's to come next, or being able to navigate a system without a map, or when you ask for help and you hear nothing back. What started off as a fight for Emery and Evan became my life's work, a mission where I break down barriers to build bridges between patients and providers, and to ensure that no family ever is left behind. I didn't just read about the mistreatment of sickle cell patients. I've seen it with my own eyes. And once you've seen it, you can't unsee it. I remember being in emergency rooms with my boys, surrounded by families that looked just like mine. And I noticed a disturbing pattern happening. The bias, the dismissal, and outright neglect. I witnessed patients in agony, pain so severe, bodies twisted, it robs you of breath. I had a patient sitting in an emergency room for over 2 hours waiting for something as simple as IV fluids. Fluids that could have potentially saved their suffering within minutes. Not because the hospital lacked resources, because Black pain is often seen as exaggerated, suspect, and unwarranted of urgency. Researcher Hoffman confirmed that many medical professionals still falsely believe that Black pain or Black people have higher pain tolerance and thicker skin, leading to the undertreatment of pain management for patients. I witnessed the throes of life-threatening sickle cell crisis. These individuals were treated like criminals instead of human beings. And it doesn't stop there. When sickle cell kiddos grow up and become adults, they enter a dangerous gap between a pediatric system that has all of the resources and an adult system that is unprepared and unwilling to understand their needs. This work is crazy. Sickle cell disease does not discriminate, but our healthcare systems do. Sickle cell disease impacts racial backgrounds and ethnic groups, including 1 in 365 African American births, 1 in 16,300 Hispanic American births, 1 in 25,800 Asian Pacific and Islander births, and 1 in 41,600 non-Hispanic white births, according to the CDC. Sickle cell disease is seen as a Black disease, so there's less research, fewer resources, and it's treated less than diseases that impact white populations. This isn't a sickle cell problem. It's the health equity crisis. The neglect of sickle cell patients is a mirror reflecting a healthcare system valuing lives or determining who lives matters and who doesn't. I know if I wanted to see real change for my sons, for every sickle cell patient, for every family left navigating this broken system, I had to become part of the solution. That led me to pursue my doctorate of social work, where I was able to take my research and my purpose and transform the lives of sickle cell patients and their families. I didn't just want to study the problem. That's what made me open up the Scott Center for Observation, Treatment, and Transition, the first nonprofit in the state of Ohio to focus primarily on transitioning patients from pediatric to adult care. And in not just focusing on the problem, I was able to build something rooted in equity, compassion, and the lives of those directly impacted. It was bigger than me. I've taken that research. I went to Capitol Hill in 2024 to advocate for patients, share my story, and that I feel we need to continue to bring sickle cell in the forefront. In that spirit, we also opened the same year our physical location for Scott Center, rooted in community-driven solutions, where we bring patients, providers, and community members and families all together to create the lasting impact needed. And in the spirit of collaboration, we partnered with the Scott Center and the Kidney Foundation of Northwest Ohio, partnered together to create a partnership not only to spread awareness on sickle cell disease, but also kidney complications. Because studies show that up to 30% of sickle cell patients will experience some form of kidney disease or impairment. This is the power of collaboration, working together, not in silos, but sharing a vision, hearing each other's lived experiences and valuing that to create the impact for communities. If there's one thing I want you to leave with today, it's this. Sickle cell disease is not just a medical condition. It's a test of our collective humanity. It's a test of whether we want to confront the biases baked into our healthcare systems. It's a test of whether we're going to ignore the pain and suffering of individuals just because they disproportionately affect communities of color. And it's a test of whether our community or our society chooses to use collaboration over isolation. The power of we drives change. So in driving change, we want to make sure that patients are believed, not doubted. Families are supported, not abandoned. Care is comprehensive, not fragmented. And social workers are seen in the forefront of everything. Because when the systems shut down, social workers show up. The power of we can the power of we can shatter stigma. The power of we can dismantle biases. And the power of we can build bridges and build a vision where every patient is seen and heard and valued. So today, I ask for you to think of these things. Ask yourself, how can I show up? How can I be a solution? How can I amplify the voices of those that have been silent? How can I ensure that no family navigating sickle cell or any chronic condition has to do it alone? It starts with us, and it starts today. Thank you.